Sorry about that. So welcome everyone, and we're so glad to see many of you here for today's session of the Health Speaker Series. The Pacific Northwest Chapter and the NNLM Region 5 have been collaborating on this webinar series for the last few years to highlight topics of interest to you, our attendees. I'm Carolyn Martin, Outreach and Education Coordinator for the network of the National Library of Medicine, Region 5, and I will be hosting, and with me is my colleague, Emily Hamstra, who will be supporting us with technical needs and monitoring the chat. Today, we have two staff from the University of Washington's Addictions, Drug and Alcohol Institute to tell us about a great project they've been working on, creating a free online library of humanizing images related to drug and alcohol use, prevention, treatment, recovery, and harm reduction. They will also be sharing practical strategies for selecting non-stigmatizing, accurate, and inclusive materials for outreach, education, and advocacy. So we have just a few items to cover before we get started. I thought we had everyone muted when they entered the room, but we haven't since then muted all of you so that we can focus on our speakers. We've encouraged you to go ahead and use the chat box to put your questions and comments. We just ask that you include everyone so that we can all see them. And that chat box is that little speech bubble that you see at the bottom of your screen. Closed captioning is available on the menu at the bottom of your screen, and you can view that by clicking on Show Captions icon. For attending today's session, you can get a Medical Library Association CE credit. Please stay on the webinar, and at the end, we will be providing you with that information. The session is also eligible for Certified Health Education Specialist, or CHES. Just know that you will need your CHES ID to complete the evaluation. The session CE is also eligible towards Consumer Health Information Specialization, or CHIS, through the Medical Library Association. Please keep in mind that we would appreciate you taking the evaluation, whether you want that CE or not. Our two speakers today are from the University of Washington's Addictions, Drug, and Alcohol Institute. We have Meg Bruner, who is the Director of Information Services, where she specializes in the retrieval, organization, dissemination, and accessibility of information for a variety of audiences. Erin McGraw is a public information specialist specializing in graphic design, instructional design, and other forms of information dissemination to engage the public in health topics related to substance use, treatment, recovery, harm reduction, and prevention. So welcome, Meg and Erin. We're really looking forward to your presentation, and I'm going to make it so that you can share your slides.
All righty, let's see here. All right, hopefully everyone can see my slides. We're off to a good start. All right, if you can't see my slides, please say something. Okay, so thank you everyone for coming today. We're very excited to finally get an opportunity to talk to this audience specifically about the Empathy Lens Project and about ways to reduce stigma against people who use drugs. I do want to say right here at the outset that we're going to be sharing some stigmatizing images today, some of which are pretty rough to look at. So just a heads up on that. Please take care of yourselves any way that you need to. All right, so I'm going to jump right in. Thank you so much for that great introduction. That means I don't have to go through this slide, which saves us 30 seconds. And as Carolyn mentioned, Erin and I make up the ADAI Information Services team of two. We're an awesome team of two. And part of our team's mission at ADAI is to improve public health by seeking and sharing valid information about substance use and substance use disorders for a range of different audiences, including healthcare providers, researchers and students, the public health and addiction workforces, people who use drugs, people who love people who use drugs, and basically everybody else. We present that information in a bunch of different formats. So it's things like blog posts, brochures, newsletters, reports, websites, social media, intervention guides, product advertisements, online trainings, and infographics. And in those formats, as you can see, we often include images. which can serve to both draw attention to the information and support the messages we're trying to convey. So images, hold on to that idea because we're going to come back to that. So part of our efforts to improve public health also include, oops, hold on, I just got a weird notification. Oh, no, okay. So part of our efforts to improve public health also include working to reduce stigma against people who use substances, which is a large and vulnerable population that faces ongoing health disparities and barriers to accessing life-saving care. So if we put those two things together, images and reducing stigma, what we get is the Empathy Lens Project. But before we dig into the project itself, I first just wanted to give you all some statistics and research that put the problem of stigma against people who use drugs into some context. So let's jump into that. All right, so according to the National Survey of Drug Use and Health, 48.5 million people in the US age 12 or older had a substance use disorder in 2023. Over 4/5 of those people, about 85%, reported that they did not receive any kind of treatment for their substance use. Of the group that said they wanted treatment but didn't get it, some of the reasons they cited for that were really revealing. So 74% said they didn't seek treatment because they thought they should have been able to handle their substance use on their own. 44% didn't seek treatment because they were worried about what people would think or say if they found out. 35% were worried information about them wouldn't be kept private. 34% were afraid bad things would happen to them if people knew they were in treatment, like they'd lose their kids or their job. And 39% didn't seek treatment because they didn't know how or where to go to get help. Though treatment is obviously not the only thing that matters here, we're much more interested in helping people who use drugs be as safe and healthy as possible, regardless of their interest in treatment. These numbers really tell a powerful story about what people who have problems with their substance use are feeling and thinking. And all of these things can be the result of stigma. Stigma you internalize that tells you you should be strong enough to manage it yourself or that you don't deserve help. Stigma from others that leads them to punish or fear you, and stigma from the system that prevents treatment and other supports from being available in communities in the first place. In fact, those are coincidentally representative of the 3 different types of stigma. We will come back to that shortly. But first, I wanted to do a quick little Stigma 101, or maybe it's an anti-stigma 101. So what is stigma? I think we probably all pretty much know this, but put simply, stigma is a set of negative or unfair beliefs someone has about something, or a mark of shame or discredit. Stigma can lead to dehumanization or the denial of full humanness to others, and it can also result in a person being rejected, discriminated against, and excluded from participating in different areas in society. Attitudes like these can have real world effects on people, especially on people who already experience discrimination, like those in marginalized groups because of their race, gender, disability, socioeconomic class, sexual preferences, housing status, age, weight, or any number of other characteristics that are also stigmatized in our culture. Stigma has also been identified as one of the strongest predictors of treatment hesitancy or reluctance to seek treatment, and a key barrier to help seeking of any kind for folks with not just substance use disorders, but a wide range of other physical and behavioral health conditions. Research has found that stigma related to substance use in particular is very widespread in healthcare, where it has led to lower rates of healthcare delivery, help seeking, and treatment retention, as well as poorer health outcomes overall. For people who use drugs in particular, stigma is one of the top barriers to both seeking and getting care. And those stigmatizing beliefs contribute to health inequities for people who use drugs on 3 levels. Those 3 examples I gave earlier. So there's self-stigma, or that internalized stigma, which leads people who use drugs to believe they don't deserve to get better or that they can't get better anyway, so why bother? Research shows that self-stigma is associated with depression, social isolation, and increased temptation to use drugs, severity of drug use, and risk of overdose. Then there's public stigma, which leads society to think that those who use drugs are dangerous or bad, which can in turn lead to all kinds of harm. Public stigma can impact housing, jobs, education, and healthcare. And because many folks with stigmatizing attitudes about people who use drugs also typically believe abstinence is the only true form of recovery, public stigma can also result in a lack of supportive community health services and even impact availability of medication treatments like methadone and buprenorphine. In fact, studies have found that people who advocate for an abstinence-focused approach to recovery typically also exhibit more stigmatizing attitudes and behaviors toward people with substance use disorders. And then finally, there's structural stigma, which acts as a barrier to services and support in pretty much every system, the criminal legal system, housing, employment, medical care, treatment, recovery, prevention, everything. And many of these systems intersect, compounding the problem and making it even harder for someone who uses drugs to get the help they want or need. Structural stigma results in reduced availability of care, inadequate knowledge from providers or others in positions of power, poor communication, reduced retention in care services, and more. So how can we, in all of our various information-related roles, help with this problem? Well, there's actually been a lot of research on reducing stigma against substance use. It's just that most of it has been focused on language. So we're going to go briefly through stigma and language here. Hopefully everybody here already knows that calling someone an addict or a junkie or using other types of stigmatizing language is not good. And it's not good because it can lead to feelings of blame or disgust toward that person, increased implicit bias, and increased desire for punitive action or punishment. Stigmatizing language can also increase perceptions that a person who uses drugs is a danger to others and needs to have their behavior regulated, as well as encourage others to keep their distance from them, which can be both isolating and also dangerous. For example, in an overdose situation, when someone needs naloxone or rescue breathing and people are too afraid to touch them or even get near them. There's tons and tons of research on the impact of stigmatizing language, and I don't want to focus too much on that here today because it's not really our topic today. But in a nutshell, some things to keep in mind when thinking about the terminology you use include using person first language. So refer to the person before describing their behavior or condition. You would say person with a substance use disorder, not addict or alcoholic. Use language that reflects the medical nature of substance use disorder, which is a chronic relapsing health condition, not a moral or a personal failure. Use language that promotes recovery and hope. I love this one. Be optimistic, be supportive and respectful of people's autonomy. It's not always about suffering with a substance use disorder. And I'm also not a big fan of like war-related terms, combating substance use, fighting addiction. A lot of people just take drugs to feel good, and that's actually okay. Not everyone who uses drugs has a substance use disorder or needs treatment. And even people who are having problems because of their substance use need to believe that they can get better if they want to, and that people care about them and want to help them with that process. Again, that insidious inside voice that tells you you don't matter or you can't do it. We can help turn that off by being more positive and supportive with our language. And then finally, avoid slang, idioms, and jargon. First of all, you're probably not cool enough for the slang. Let's be real. It's going to be low-key cringe, as my fellow kids would say. But more importantly, slang and jargon can have negative meanings and be stigmatizing, sometimes without you even realizing it. And they can also just be confusing. So keep it simple and be straightforward. So that's language. But obviously, language is not the only way information is conveyed, right? Images are also very powerful tools for conveying messages. In fact, studies have found that when people are presented with both text and images, surprise, surprise, they're much more likely to look at the images than they are to read the text, giving those images a lot of influence over the attitudes of the viewer and what information they take away from that encounter. For example, in one study, researchers gave participants a story about a person with depression. Some people got a version of the story that included either photos or illustrations of the person, like the ones you see here, and some just got plain text, like what you see in the box. What they found was that people were much more likely to identify with the story subject, feel close to them, and even donate to a mental health cause when the story was accompanied by an image of the person being described. And it didn't matter if it was a photo or an illustration, which is kind of interesting. And that is the kind of power a simple image can have. Consciously or not, though, images can also be used to reinforce stereotypes and prejudice. Images can change the way someone thinks, feels, or responds to a subject, whether they're aware of that happening or not, which can have positive or negative impacts. They can also perpetuate misinformation, which is a rampant problem in commercial stock photo collections like Shutterstock. Also, images of drugs, drug use, and drug use equipment like pipes or syringes can trigger trauma and craving in people with lived or living experience of drug use. That's called cue reactivity, and it can also be harmful. All that tons of research on stigmatizing language, though, has not been replicated with images or other media. There's very little research on this by comparison. So if you're a researcher in the audience today, I just gave you a great idea for your next project, and you're welcome. What research there is that has examined the portrayal of substance use in news media, movies, TV shows, and drug prevention campaigns, all examples of visual media like things pictured here, have found that media portrayals of drug use are often sensational, melodramatic, dominated by moralistic understanding and surprise commercial needs, riddled with misinformation, and usually completely divorced from science. We probably all are aware of that, right? Additionally, gender, race, disability, and other intersectional components of identity come into play with images and addiction-related stigma as well. For example,
Yeah. Mm-hmm.
oh, for example, a 2018 New York Times article about mothers addicted to prescription opioids featured photos of a white woman or white women lovingly holding their babies, like the one you see on the left, while coverage of Black mothers in the 80s and 90s who used crack cocaine was treated quite differently, as you can see, often featuring photos like this one of a Black woman smoking while her baby cries alone. While the publications themselves may not have intended to reinforce racist stereotypes, the images support those notions pretty implicitly. Another good example of the use of stigmatizing images, this time in prevention campaigns, can be found in the Faces of Meth campaign launched in 2004 in Multnomah County, Oregon. This campaign started when the local sheriff began distributing mugshots of people arrested on methamphetamine-related charges, and they did this without the consent of the people photographed because mugshots are considered public records. It's thankfully a little harder to do something like this now with mugshots because of changes to the law since then, at least in Oregon and Washington, so that's some good news. But as you can see, the pictures here were taken several years apart, with the older photos showing the individuals looking younger, with clearer skin, cleaner hair, etc. In more recent photos, after years of substance use and the chronic health and social issues that can go along with it, like homelessness, poverty, lack of access to healthcare, the individuals look sadder, sicker, and often have facial wounds that may or may not have actually been caused by their drug use. The intention here clearly is to shock, scare, and disgust the average viewer to make them afraid to use meth and also afraid of meth users, right? And though this approach might seem logical on some level, and in fact it is still used in prevention campaigns today, research has found that messaging like this, messaging that relies on fear or disgust, is not effective. It does not change attitudes or behavior. Another study involved showing images from both the Faces of Meth campaign and also this campaign, which was called the Meth Project, to actual people who use methamphetamine. And this study revealed an additional problem with this type of exaggerated or extreme imagery. Because these images are not representative of what the average meth user looks like, many people who use meth can't relate to the people pictured and reject the accompanying messaging as a result. In other words, they think, that's what a person with problem meth use looks like. I don't look like that, therefore my meth use is not a problem, and this messaging doesn't apply to me. So it's not only harmful, it's also just ineffective on basically every level. So now we know that stigmatizing images can result in harm. What effect do non-stigmatizing images have? Well, again, there's not a lot of research on this, but not only can we, I think, logically extrapolate from the research on language, especially the research that has found that focusing on solutions and more positive portrayals, like the possibility of recovery, is more effective. There was a recent study published that spoke pretty clearly to this question. Oops. All right, in that study, which was just published earlier this year, researchers gave a survey to over 3,400 people. Respondents were randomized to one of 8 groups or to a no images control group. All the groups read a short introductory text about the drug overdose crisis, and then the experimental groups each viewed one of 8 photos accompanied by a simple caption that described the picture. These are some of the photos and the captions they saw. So you can see some groups got a photo of someone injecting drugs, some got a photo of someone who had overdosed and was being helped by EMS. Some got a photo of a person receiving methadone for their opioid use disorder, a photo of a person in recovery in a work setting, and some got a photo of someone who had lost a family member to overdose. Everyone was then asked to complete a survey that measured their emotional reactions, their support for health services and drug treatment in their communities, and their levels of stigma, which they measured by asking questions about whether they'd be willing to have a person who used drugs marry into their family, work closely with them, or to have them as a neighbor or friend. So, what they found was that the group that saw the photo of the man in recovery was almost 9 points more likely than the group that saw no photos to be willing to work closely with a person who used drugs, with similar estimates for the other stigma related items. So, their stigma decreased as a result of seeing that one positive photo. Not by a huge amount, but we will take what we can get, right? The photo of the man injecting drugs, on the other hand, made people 14% more likely to report disgust and similarly more likely to report pity compared to people who saw no photos at all. Also important, though people who saw the photo of the person receiving methadone treatment for their opioid use disorder, that's what these men are doing in these photos, while those folks were less likely to report feeling anger or disgust than those who saw no photos, they also included a version of that photo, the one on the right, in a jail setting, and it was less effective at reducing those negative feelings than the one in the community setting on the left. So, pictures showing people in recovery or treatment helped improve the respondents' attitudes and reduce their stigma. Pictures showing people in active drug use, overdosing, or in jail, on the other hand, not so much. Though while those pictures heightened people's emotional responses, they didn't actually increase their ratings on the stigma items. They just didn't decrease them, which is interesting. Whoops. Disappointingly, no photos at all did anything to move the needle on folks being willing to allow treatment or supportive services into their neighborhoods. So, across all groups, only about half said they were willing to have a drug treatment program in their neighborhood, and only about a quarter were willing to have a syringe services or harm reduction needle exchange type program. And then only even less than that were willing to have a safe consumption site. This is actually one of the goals of the Empathy Lens project, to try to show these kinds of settings as warm and safe and very, quote, normal, both for people who use drugs and have trauma related to stigma they've experienced, and for people in the communities where those services are located, because they might have biases or perceptions of what those service places look like or are like and makes them not want them in their communities. This study didn't actually show those kinds of settings like our pictures do, so maybe our photos might be more effective at moving the needle on this. Again, researchers in the audience, please reach out. What this study does teach us, though, is that, oops, skipped again. Realistic and humanizing photos can be an effective stigma reduction strategy. It points to the need for people who disseminate information, from the news to public health educators to even treatment or prevention organizations sharing content on social media, to be aware of how our choices of images can shape attitudes toward this highly vulnerable and stigmatized group of people that we all care about so much and just want to help live better lives, however that looks for them, right? And that brings us to, at long last, the Empathy Lens project. And now I'm going to hand it over to Erin. Let me unshare.
Thank you, Meg. Let me go ahead and get my slides going here. All right. Hopefully everybody's seeing that. Let me know if you can't. Hi, I'm Erin. Next, I'm gonna go do a deeper dive into the Empathy Lens project, which is a project that Meg and I started this year. I guess technically we started it last year, but we launched it this year, to address some of the issues that she's been talking about around stigma and the representation of people who use drugs in media. So, as public health communicators, we, as you saw earlier, use a lot of images in our work, and they help us do things like convey information, support concepts, and explain research and data. And in fact, research shows that images also help people absorb information and learn better. And in this work, finding images of substance use and their related services has always been really hard for us. There just hasn't been a lot out there that shows what these spaces and interactions actually look like. And the images that do exist on stock photo sites are often really obviously staged, and they're also really dramatic and stigmatizing. And you could see some of those earlier in Meg's part of the presentation. They also sometimes are just plain incorrect and have misinformation in them. And as we learned earlier, stigma can really affect someone's sense of worth, their ability to engage in treatment, and even the availability and quality of healthcare that they can receive. So our solution to this in our little corner of the world, and this is something, we had talked about for the better part of a decade, was to create our own images of real community organizations. But to do this, we needed funding. So finally, last year, we applied for and were awarded a grant from the network of the National Library of Medicine for an Outreach and Education Award. So thank you, big thank you to them. And as we started developing the project, we came up with some important goals. First, we wanted to make sure that we were showing real life spaces, supplies, and interactions between staff and their clients who use drugs. We wanted to make sure that we were showing these services in a very realistic and humanizing way. And in that process, we also decided to protect client confidentiality, and we only used staff volunteers in our photos. And we were lucky in this way because they are the ones with firsthand experience, so they know what things really look like. We also wanted to make sure that our process with our partner sites was really collaborative because honestly, like they are the boots on the ground experts, and so we wanted to defer to their expertise. And we wanted to make sure that we understood what was important for them to show and make sure it was as accurate as possible. And unlike many other stock sites, which require fees or subscriptions, we wanted to offer the images for free and without any barriers for use, so that they would be used as widely as possible and hopefully kind of take the place of some of the other stigmatizing alternatives. And last, we wanted to use this project as an opportunity to reach out to the public and provide education on how to select images with dealing with stigma in mind. So to make the collection, we coordinated with 3 different sites across Washington State last fall and visited them for photo shoots. And this happened at Blue Mountain Heart to Heart in Walla Walla, Washington, Tacoma Needle Exchange in Tacoma, and the Recovery Cafe South Lake Union in Seattle. And the cool thing is each of these sites really does represent unique services, demographics, and missions. So we got sort of a broad spectrum there. And from these 3 visits, we edited and posted over 200 photos that make up our current collection. So with our collection started, we also needed to make a website for folks to be able to access and download them. And we launched our website, empathylens.org, earlier this year. On the website, you'll find our full collection of over 200 free images. There's also a page on stigma education that includes really handy tips for selecting non-stigmatizing images and also a printable brochure with the same educational information to make it easy to put out there. And we also have a list of other free and relevant image collections and also places to find accurate information on substance use. So here's what our front page looks like. And to find specific images, you can use the search bar and type in a term. Here I'm typing in naloxone, and you can see all the different results that pop up, everything that we have related to that particular topic you can search for. You can also browse by category and find a lot of images that way too. Here you can see all of our different categories. And as one example, here I'm looking at community, so you can see everything related to community spaces, community meetings will pop up under that category. And here are a few samples of some of my favorite photos from the collection. You can see that there's photos around drug checking, around safer use supplies and mobile services. And there's also a lot of great images of realistic interactions like overdose education and peer support and community meetings. There's also images of medical and mobile health services. And honestly, there's a lot more categories, and this is really just a quick little peek. So another important part of this project is also the education on stigma and how it affects the health, access to services, and well-being of people who use drugs. So we created another page offering some in-depth education on the subject, which includes interactive elements and also that list of tips on how to select images, and I'll go into that in more detail in just a minute. And also some great examples of what to look out for when you're choosing images to use that represent substance use and its services. We also developed a brochure with this information to make it easy to educate others. It's currently available to download on empathylens.org on our stigma education page, but it's also available to order for free for Washington folks through the ADAI Clearinghouse at adiclearinghouse.net. So please check that out if you're interested. And here's a quick snapshot of some other free image collections and accurate information on substance use that we link to on our website. These are really great resources to find more diverse and non-stigmatizing images beyond our own collection. And don't worry about writing these down now because you can always find the full list on our website. So check that out. All right, so now the exciting part. We're going to go over some tips on how to select non-stigmatizing images that you can keep in mind whenever you're on the hunt for using ones in your own work. And I'm also going to share some research to back it up. So in 2023, researchers conducted a study that looked at the reactions of people with lived experience of substance use disorder to SUD-related images. The participants were from diverse backgrounds, and all of them were at various points of recovery. The study was pretty limited by having a small sample size, and I think that really makes it clear how badly more research is needed in this area. So, what did this study find? First, that participants experienced cue reactivity, which Meg mentioned earlier, when shown images of drug use and drug use supplies. It triggered trauma and craving in people who did have lived experience of substance use. It also found that really dramatic or staged or negative images triggered a negative association with recovery and treatment. So again, it triggered memories of trauma, of medical mistreatment, and stigma that they had already experienced in their lives. And on the other hand, images that showed care, support, and positive medical treatment reinforced ideas of health and well-being related to recovery and getting help. Another consistent and important theme was that diverse representation was really important to the participants because it combats stereotypes and emphasizes that anybody can develop a substance use disorder. So with this in mind, let's look at some rules for picking non-stigmatizing images related to substance use. So first, it's really important to avoid misinformation. You want to make sure that the images you choose don't spread false information, like in this example, which suggests that acetaminophen is an opioid when it's actually not. You also want to avoid triggering images like ones that are really dramatic or negative. Also, avoid images of drugs or drug supplies unless you need them to explain something specific or you're educating about them specifically. You do want to show different kinds of people. People who use drugs and their service providers come from all kinds of backgrounds, races, genders, ages, etc. And we know that substance use disorder can affect anyone, so images should reflect that. You want to make sure that you keep it positive and simple, so pick images of everyday people in normal situations, especially ones showing positive interactions and well-being. To avoid triggering images of drugs or supplies, one tip is that you can always use a neutral or broader concept image. Like on this, you'll see a dictionary page with the word opioids, and you can use something like that instead of images of things like pills or powders. And last, and maybe most importantly, you want to make it humanizing. So make sure that the subjects in the images are treated as full people, not just focused on their drug use. Avoid images where someone's face is hidden with only their drugs in focus. And honestly, these are so common on stock sites. You'll see them all the time if you go there. And that's kind of what we're specifically trying to avoid in this collection here. Okay, so let's take all those guidelines and use them in real time here. So we're gonna do a quick activity, and I would love it if everyone could please type in the chat box whether you think the images on the screen are stigmatizing or not, and more importantly, why you think so. And I'll give everybody a quick minute and then we'll go over each one together. So go ahead and let us know in the chat. Is this image stigmatizing or not? And why do you think so? I'll keep a quick eye in there. Yeah, lots of great responses already. Wow. Yeah, the focus is on the drugs, stigmatizing. Yeah, their face is hidden, dehumanizing. Shame, exactly. Yes, yeah, everybody's really nailing it already. So let's go over this one really quick. Yes, as people were saying, exactly, it is dehumanizing. Their face is blurred out and obscured while it's their drugs that are in focus. It's triggering that cue reactivity. It's showing drug supplies not for an educational purpose. And yeah, it's dramatic. The person is clutching their face in distress. It's very negative. So yeah, really great responses. Okay, so moving on, how about this one? Is this one stigmatizing or not? And why do you think so? Great responses. Yeah, showing touch and care. I like that. That's really a great point. Humanizing, normal environment. Yeah. Yeah, showing the full person and neutral. Yeah, very good responses here. So yeah, we'll go over this one really quick too. It is normal, and I'm so glad to have seen that in the chat. The subject and the scene are both really casual and realistic. It's showing a positive interaction. They're receiving support and healthcare supplies. And yeah, it's humanizing. The subject is shown as a whole person. Okay, how about this one? Stigmatizing or not, and why do you think so? Yeah, I'm so glad somebody said dramatic and medically inaccurate. Yes, that is absolutely true. Very dramatic. Yeah, the word death. Yes, exactly. Shocking. I'm so glad people are saying that it's inaccurate. Yeah, that is exactly right. So, yeah, first of all, this is misinformation. We know that methadone is a safe and effective treatment for opioid use disorder, and this kind of really melodramatic image might make somebody afraid to try it. And it is dramatic. There's this impending sense of a crash or doom with the big stormy cloud. All right, next one. Stigmatizing or not, and please tell me why. It is probably, the last one probably was AI generated, honestly. They're very weird. Yeah, I'm glad to see some of the responses here. Yeah, focused on the environment. And them being hidden, exactly dehumanizing. Yes, they're completely on it already. So yeah, it's dramatic. The tone is really scary and intense. It is triggering, even though it's not showing drug supply specifically. It's is showing somebody in a really harsh environment. So I'm really glad to see some of those responses talking about that. And yes, it is also dehumanizing. The person is hidden, they're clutching their face, they're anonymous, they're really reduced to their circumstances and environment. Okay, I think this is our last one. So go ahead, stigmatizing or not, and please tell me why. Seeing some good responses. Yeah, that it's realistic. You can see that they're smiling. Yeah, exactly. It's a positive interaction. Yeah, and yeah, representing diversity too. Yeah, some great responses here. Absolutely. So yeah, this image, it's normal. The setting is neutral and realistic. Somebody said looks like a doctor's office. So somebody receiving positive care. It's positive. The focus is on getting support and receiving care navigation. And obviously the person here is happy to be receiving that care. And it's humanizing. They are happy and they're receiving services. So overall, very positive. Yeah. Thank you. And cooperation. Yeah, exactly. It's collaborative. Really good responses. So awesome. Thank you so much, everybody, for submitting answers. There were so many great responses. And next, I'm going to go into a little bit really quick on what is next for our project. So now that phase one of launching the collection is finished, we're looking to keep the collection growing. And we're always looking for ways to expand the collection, including new community sites, different populations and topics, and different settings and environments. And primarily that means hunting for a small amount of funding for additional travel for site visits. And a big component of our work is also continuing to share the collection and talking about stigma education, so we're always finding new avenues to do that too. We wanted to make sure we gave a huge thank you to our partner sites who offered their spaces and themselves to support our project. Without them, it really wouldn't have been possible. These community organizations and their staff and their clients are really doing hard work every day to make the world better, and we think they are all absolutely amazing. So a big thank you to them. And we wanted to thank you for sticking with us today. If you have any questions later or ideas for the collection, you can always reach out to me and Meg anytime. And please also make sure to check out empathylens.org. And with that, I think we will turn it back to our NLM folks.
Thank you so much, Meg and Erin. That was a great presentation, and that interaction at the end was really great. Gave people a chance to try it out and to add some learning. Before we take Q&A, I just want to make sure, because I know some people have to leave early, and I want to make sure that you get the evaluation link, which will take you to more information to get the CE credit. So let me go ahead and share my screen again. So just to let you know that there is a evaluation link that Emily will put in the chat box. And just make sure you follow the directions that are in that evaluation. They will ask you whether you want the MLACE credit or if you want the CHESS credit as well, and then more information will follow. Let me get the next thing. Sorry about that. And if you want to get the Certified Health Education Specialist CE, please complete the evaluation to register your attendance and to receive that certificate. You will need your CHESS ID number to complete that evaluation. So please be aware of that. And I also wanted to mention that we are in the midst of planning the next session of the health speaker series with PNC in Region 5. We don't have the registration up yet, but keep an eye on our link that Emily will also put in the chat to see when that will be available for you, hopefully in the next few weeks. And I also want to go back to Meg and Erin, and for you to go ahead and ask your questions and continue with that. I did have one question for you both. You mentioned expanding your collection, and I was wondering, is there a way for people to submit their own photos to add to the collection, or is that something that isn't usually done?
We've thought about possibly adding that in the future. It's a little bit tricky just because we have to get consent, UW consent forms by anyone who was in the photos. And we want to be really cautious with that consent process because these are photos people are going to be using on websites about addiction or drug use. You know, it's just a little bit different from a normal stock photo situation, I think. So at the moment we are not accepting, but maybe someday we will figure out how we could make that work well, for sure.
Thank you, Meg.
Yeah, yeah. I don't see any questions, but I did also want to mention that we just launched at ADAI today a summer internship program for UW undergraduate students, and I'm putting a link in the chat to that. Our team is leading one of the projects. There are 3 that we're looking for an undergraduate intern for this summer, and our project will be to help us develop a stigma education campaign that will tie in Empathy Lens and other stuff. So if you know any UW undergrads who are looking for a summer internship that is paid, thank goodness, send them that link. We would love to hear from them. Yeah, I don't know if Getty wants us to come train them, but we'd be happy to train Getty. They could use it.
It's good to hear that there's at least one site out there that has some positive images.
Yeah. Have we thought about using AI? I think we are both on the same page in being somewhat against using AI for art specifically, but maybe someday, I don't know. At the moment, it doesn't seem high quality enough to me. And the risk for misinformation there is super high as well, I would think.
Yeah.
Yeah.
I think too, a big part of our ethos is showing real people in real
Yeah.
settings.
Yeah.
So just on yeah, that side of things.
Yeah.
It's been important for us to go to the actual locations and make
Yeah.
sure we're showing what they look like.
Yeah. And we're hoping to get some funding. Right now, the UW has a travel freeze, but our institute has offered to fund us to do some more travel whenever that is undone, so that we could go to like maybe medication for opioid use disorder treatment place that does methadone or bupe or something like that. There's also a new overdose recovery center in Seattle, the Orca Center, that we would love to go and get pictures of. So we have lots of ideas for future photo shoots, and hopefully we will be able to go do that soon. Let's see. Do you think the studies of communities against having services in their community are valid? I mean, the stats you gave show there's a high likely that they themselves may have it. Yeah, I mean, I don't know. I do think that people can be biased against a thing that they also struggle with. We see that all the time, I think. So sure, that could be a possibility. There is a lot of research on that sort of investigation into NIMBY attitudes around this. So if you're interested, you should definitely be able to find that. Usage stats. We do. Oh, we should have mentioned the usage stats. Yeah, people are using this. It's been very popular. We've been hearing from people all across the country that are so excited to find it and asking if they can collaborate with us and things like that. So we're very encouraged for sure. Some of the most used photos were kind of a surprise to us. They weren't the ones that we would have picked as like the coolest photos, but you never know what people are going to do. It depends on what they need, I guess. Gosh, there's a lot of questions. Okay, this is great.
Someone had a question regarding the internship and who was eligible. If
Oh, if
undergraduates
it's
at Tacoma or Bothell can.
it's any UW undergrad, and I think Tacoma and Bothell would be fine. There are going to be some in-person field trips that'll be around Seattle, but it would only be like maybe 4 of those out of an 8-week thing. So as long as you're willing to go to Seattle because you're going to get a chance to go see like the overdose recovery center and maybe a harm reduction center and needle exchange. So as long as you're willing to do a little bit of Seattle driving, then that should be totally fine. Yeah.
So the chat is getting busy. Would it be helpful
Yeah.
if I read some of the
Yeah, that
questions to
might be
you as
helpful.
they
Yeah.
come in, and then you can focus more on your answers?
Yeah, that would be helpful.
Okay, so here's one. Do you have any advice on how to do press interviews to avoid the trauma focus that they can often take?
Gosh, do I have any advice? I mean, I'm married to a newspaper reporter, so I don't know if I am going to be able to answer this. I think most reporters that I know, and I do have a bias here, are going to be pretty open to hearing from you about your expertise and that you can talk really openly with them about your concerns about that. And hopefully they will be respectful of that. I know the Seattle Times, which is where my husband works, has a whole mental health reporting team now, and they are amazing. So if you're talking to reporters or you want to talk to reporters, I would look for someone who has some experience reporting on this and just see what their reporting has been like in the past. And just do feel always able to just be brutally honest with reporters because they do need that from you, frankly. I agree with that. I don't know if Erin has any other advice there.
Yeah, the only thing I could think of was just make sure in your own language that you're using things like person first language, the way that you talk about it, kind of some of those tips we were giving on being positive and focused on recovery and possibilities generally and how you talk about it.
Yeah, that's great advice. Yeah.
Okay, and there's some comments here. We can highlight those if we don't get through all the questions. But here's another question. In the event that showing drug supplies is necessary, are there websites you would recommend for photos? The community college where I work has a few health degree programs which discuss substance use.
So our collection does have photos of supplies. So there's photos of syringes and things like cookers and cottons and some of those more general supplies. Other than that, I'm not sure if any of the other collections, there's a collection at JSAG, the journal of whatever they've changed their name to at this point. I can't remember. Um, and they had more photos of things in them, like signs and the bottles of alcohol and things like that. I haven't looked recently, but they might have some of those types of things as well. Yes, thank you, Emily. So we do have like a bunch of supplies photos. And then if you go to that other collections, you'll see the JSAD photo collection there, and they might have some things. Yeah. You're welcome.
Okay, I'm going to read some of the comments that came in, and you can feel free to respond to those too. One person says, mine is an embarrassing comment, but it reflects the impact the images have on me. I do homeless outreach, so often the folks I work with are dirty since they don't have access to showers. One of my first thoughts in the photos is that they weren't real because the subjects were too clean. And luckily, I realized my own biases, and thanks for doing your great work.
Oh, thank you. Yeah. I mean, I think because we were being careful not to actually photograph clients, there is definitely that's not an unfair assumption to make or feeling or reaction to have, I would say. But yeah, I'm not quite sure how to capture that aspect. It's just everyone's different everywhere you go, but I do feel like, I mean, we at when we were at some of these treatment organizations, we did see clients that were outside and they really did just look like normal everyday people. So, I mean, it can just be you and me. We could be in need of those services someday ourselves. So that's kind of the sense we want to convey with these photos.
Yeah, I think that's part of sort of humanizing these services is that when I've been visiting these sites for at least a couple of years now, doing various like photo and video shoots, and each time when I've seen clients visiting, there are all kinds of people and all kinds of circumstances that visit them. It is, I think, probably more on the stigmatizing side of things to have that in our photos, like somebody who maybe hasn't showered in a while, and to do that would be really difficult for us to capture. So I think that's why we focus more on clients who look a bit more, I guess, everyday. But they do exist too, and they go to those services all the time.
Mhm.
So here's another comment that's a reflection. Unfortunately, some of the most stigmatized areas are the ones that are the most highly affected. I see it in my hometown in Appalachia where the opioid epidemic is rampant.
Yeah, very true.
I think too, regionally, there'll be really big differences too in how these services are perceived or accepted or not. I think everywhere struggles with stigma against these services, which is what we're trying to help, but some areas of our country more than others even.
Yeah.
And here's a comment I want to read that went back to the question about talking with the press. Our medical director went through a media training to help her redirect an interviewer to get what she wants to communicate. Too often, interviewers ask an obscure question and that then derails the interviewer from the important messages.
Yeah, I totally agree with that. And I think I'm just gonna, don't tell my husband I'm saying any of this, but I think when, especially when newspapers had to cut a lot of their staff in the last several years, the last decade really, because of funding cuts, a lot of the reporters that were really expert in very niche areas like maybe healthcare or addiction or whatever, they were not the ones kept. Maybe they were newer or they didn't have as much experience or whatever. So now you have a lot of reporters that are covering multiple beats and it's very difficult for them to be an expert the way maybe they used to be able to do. If you're covering everything from politics to public health, it's hard to know everything you need to know. And that's why I think reporters are very curious people. You can talk to them openly, but they really do need your guidance if you're the expert. I would say that's always the case, and that good reporters will always be open to that guidance. They don't always get it right, I know, but they do try. They really do. I see a question. So in your usage stats, are you able to collect what industries are using your images to? No, we don't have any information on who is using the pictures, though we have heard from everyone like most academics and also other harm reduction services organizations, I think are the ones we've mostly heard from who've been using them. At some point, we should try and do some reverse image searches on Google and just see if anything pops up. That would be kind of cool. But we don't have a way to like capture that specific type of information, who is using them and for what. Maybe someday we'll do a survey and see what happens. That could be cool.
I think an exciting one was the Washington State Department of Health
Oh yeah.
used one of ours in a social media post, maybe.
Yeah, and I'm in a lot of the photos because I was just a game volunteer. Every time we were in this, I'm like, throw me in there. I'll be a patient or what, a client or whatever. And then so I was scrolling Facebook and I saw a picture of me and I was like, what is this? And I realized it was one of our photos. It was really cool to see it just live out in the wild like that.
Yeah.
So here's another question. So the participant says, I'm working with my community to educate faith leaders and connect faith in places that offer residential addiction services. Are there resources that you would recommend for educating clergy about the issues of stigmatizing language or educating a congregation?
I mean, I don't know if it's necessarily specific to clergy, but our website has some resources on stigma education. There's a whole tab that says stigma education. And if you go in there, you will find some other resources that involve language. And those would be great places to start. There's actually just tons and tons of that out there. There's some really great resources that anyone, I think, would find useful. We're also happy to come do a webinar for your No, I'm kidding. You probably don't want to say at your church either, but there's just a lot of information on language specifically out there on this subject because it's the part that's been focused the most on, I would say, in terms of research and education. Oh, thank you, Emily. Emily put the link to the stigma education page in there. Awesome. Maybe you could do a webinar for your congregation. That would be cool. Just an idea.
It's a great idea.
Yeah.
And you got a yes in the chat.
Yay! Let's do it.
Spreading the word.
That's right.
We
So there was
have,
go ahead,
good.
Carolyn.
I was just going to say we might have time for one more question or comment.
If we want to end on a yes, awesome, I'm also fine with that. The final comment, awesome.
It's a great note.
Well, thank you everyone for attending today's session, and thank you, Meg and Aaron. We really appreciate it. I think it really resonated with a lot of people and fills a need that we need so much. And for being part of the solution by providing this repository that is so needed. And I wanted to also mention people had asked about slides. Give us a little bit of time, but we will have those available soon on this link that I just put into the chat box, which is the same page that you used to register. We will also add the recording there soon as well. So thank you again, Meg and Aaron, and to everyone. And we hope you all have a safe and healthy holiday.
Thanks,
Thank
you
you.
too.
Thank
Bye.
you. Hi, everyone.